In the Allergan version of the band, there are two types of ports. One port is called a standard port, and this is called an access to smaller size version port. Okay, and so this port is different. The port is actually, the band is accessed by putting a small needle called a Huber needle through the spongy part of the device itself, and then it has a sort of a well in the back that we inject the saline into. And it's sort of a two-way valve that is pressurized that will keep the fluid actually in the device itself and not in the well. Okay, so that's essentially how it works. Now the band here is typically we suture it into place, but there are several methods for anchoring the band. Some people actually use a mesh underneath to sort of secure it. Now the Realize port is right here. The Realize port is a little bit different. The manufacturers have sort of developed this port with small anchor facets on the bottom of the port. And basically we use a device to anchor that in, and it just snaps into place, so there's no suturing. Now the theory behind that, there's a little less discomfort, but typically most of the band patients report discomfort for maybe a week with the port. It's with the Allergan port. However, that's all very subjective, as you know, and pain is very subjective. I've had people with both that report no discomfort at all.